Hi, my name is Dr. Chukwudi Charles Elono. I'm a consultant psychiatrist. They like call me a behavioral physician. I'm sure you must have been hearing the word depression. Yes, this is a very common mental illness that people usually have. Now, today I am going to concentrate on describing the symptoms of depression. Now, there are several symptoms of depression. I'm going to concentrate on the major ones. So today I'm going to talk about 15 major symptoms of depression. Number one, there's what we call low mood or feeling sad all the time. Most people who have depression experience feelings of sadness most of the time. This usually happens in the morning or in the afternoon or in the evening. They usually feel sad, and sometimes they may not be able to describe or understand the reason why they are feeling this way. Number two is reduced energy. People who have depression know that they do not have energy. They don't have that level of strength to do some activities which they used to do before. So what usually happens is that they notice that most of their chores, house chores, are left undone. Things they are supposed to do, they're not able to do them because they have less strength compared to when they did not have depression. Number three is loss of interest. In medical term, we call it anhedonia. It means loss of interest in activities they used to enjoy before. For example, when an individual becomes depressed, he may notice that he no longer enjoys watching football, or he no longer enjoys playing table tennis, or any chore, or rather any activity or leisure that the individual used to love or enjoy before. When the person becomes depressed, the individual will hardly want to engage in such activities. Number four is lack of sleep. People who have depression usually have problems with sleep. Either they have difficulty initiating sleep, or they have difficulty maintaining sleep. Usually, the one that is more common in depression is difficulty maintaining sleep. Usually, when they go to bed, they notice that at the early hours of the morning, say 1 a.m. or 2 a.m. or 3 a.m. as the case may be, they notice that they're not able to maintain sleep. So they usually wake up, and usually at that time, they feel very terrible about their life. They have these negative thoughts that usually come in at those early hours of the morning, making their sleep difficulties even worse. Number five is loss of appetite. When an individual develops depression, they will notice that they have less interest in eating. Some people lose weight in the course of having depression because they notice that they are not able to eat. In fact, I have seen someone who fails to eat for about 2 to 3 days because they have depression. They will tell you that they are not hungry, so they can go days without food, and they usually lose weight in the process. Number six is loss of interest in meeting with one's partner. You know what I mean? Losing interest in meeting their partners in the other room. So this usually happens in depression. And when it happens, you may begin to notice that it has started affecting their relationship, start affecting their marriages. And usually, if your spouse does not know that it is depression that is bringing about this, it usually makes the whole problem more explosive. And there is usually issues of divorce during depression and issues of separation during depression. So this is what will likely happen if depression causes loss of interest in meeting your spouse or your husband or your wife, as the case may be. Number seven is difficulty concentrating. In depression, there is usually difficulty in concentration. This will make the individual not to be able to work effectively at home, in the office, or anywhere they are doing their work, as the case may be. They begin to have problems with their bosses, they begin to have problems with their spouses, and problems with people that they work with because they are not able to concentrate and do the job very well. Number eight is negative thoughts. Yes, I guess I've mentioned it during sleep. Negative thoughts is one of the one of the symptoms of depression. People who are depressed, no matter how highly placed they are, they think that they are less humans or less, less exposed or less important. They think very little about themselves. They have all manner of negative thoughts. They have all the problems they've had in life will begin to come to their head whenever they have depression. And because of these negative thoughts, it makes their sadness or their mood to get even worse. Number 9 is memory difficulties. Individuals who have symptoms of depression also have memory difficulties. This memory may not necessarily be that they have primary problem in their memory centers in the brain. This problem may as well be because they have difficulty concentrating. If you have difficulty concentrating, that means that whatever that happened at that time that you lose focus or you lose concentration, you may not be able to remember activities at that time. And when you are asked about activities those times, you may not be able to remember, you may not be able to say things that have happened in those periods. So with that, it may look as if you're having a primary memory problem. But in reality, you may not be having a primary memory difficulties, but because you are losing concentration, you are losing focus, that may mimic somebody who has memory difficulties. And this is usually seen in people who have depression. Number 10 is social withdrawal. Social withdrawal. Individuals with depression will not want to engage in outdoor activities. They don't want to engage with other people. And what you begin to notice in them, they begin to get withdrawn. They prefer to stay inside their rooms, inside the comfort of their homes. They don't want to come out to meet people. Sometimes they refuse to answer their calls. When you call them on phone, they may not want to answer and they are not going to call you back. So these individuals begin to withdraw socially. They don't want to engage in activities. Those are the people that will not come for weddings. They will not come for any party, anything that is outdoor. They prefer to stay on their own and not talk to anybody. When you have somebody who does not pick your calls most of the time and does not even show his or her face to you, or rather does not present himself to you for interaction and all that, that person might be having depression. So you may have to also raise an alarm on behalf of such individuals. Number 11 is lack of motivation. When you are depressed, motivation will reduce because you are not feeling so good about yourself. The self-esteem is not there, self-confidence is not there, so motivation will not be there, and the individual will not be able to pursue activities that he or she is supposed to pursue at that period of time. Number 12 is feelings of hopelessness. When an individual who has depression looks into the future, they see nothing. No matter how highly placed the individual is, no matter how well achieved the individual has already become, yet they are not able to see their future to be bright. They see a bleak future when they look into the future, and this is a very major or very important sign of depression in individuals. Number 13 is worthlessness. In depression, you feel worse than your counterparts. You feel that you are worth nothing compared to your counterparts. Even though you may even worth more, even though you may have been more achieved compared to your counterparts, as long as there is depression, you may notice that you feel less compared to your counterparts. So it's called worthlessness. You feel that you are worth less than your counterparts. Number 14 is crying spells. Individuals may indulge in intermittent or frequent crying. Sometimes they stay in their rooms, lock up themselves and be crying inside their rooms because they are feeling very moody and sad. So symptoms such as repeated crying, or call it crying spells, is usually found in people who have depression. So if you have individuals who usually cry while inside their rooms, locking themselves up and shedding tears most times, especially for a period that is more than 2 weeks or so, you might have to alert the person that he or she may be having depressive illness. Finally is suicidal thoughts. Suicidal thought is one of the extreme symptoms of depression. Individuals who have gotten to the level of thinking about ending it all means that the individual has severe depression. I'm sure you must have read in papers or you have seen on social media where people have been said to have jumped from heights or jumped into the lagoon. These individuals may have been depressed, and most times we don't understand that these individuals have been laboring under depression, severe depression, and sometimes we keep blaming them for such incidents, but it's our duties and our responsibility as individuals to help these people. When we feel that our neighbor or our friends or relatives have depression, it is important that we create we alert the other members of the family, so that those individuals might be taken to the hospital for assessment and treatment if they have depression. These are the 15 signs of depression in which an individual might have. So one thing that is important here is this: you do not have to have all the 15 symptoms that I have mentioned. There are criteria. Once you notice that you have 3, 4, 5, or 6 of these things that I have mentioned, please, you might have to see your psychiatrist so that you be assessed for possible depression, so that treatment can go on early enough so that the individual does not tip into having severe depression that will lead to him ending his own life. So if you like this video, please like, share, and subscribe. Thank you very much for listening.